Hello, my name is Carlos Eduardo Sabrosa, and I'm a dentist practicing in the city of Rio de Janeiro, Brazil. I'd like to introduce you to a new development called the Penguin Go. I have over 30 years of clinical experience, not only private practice, but also as a professor researcher in the fields of prosthodontics, biomaterials, and implant dentistry. One of the challenges we face in treatments involving osseointegrated implants is the validation and verification of an implant's stability before proceeding with the restoration. The surgical procedure related to dental implants consists of placing an implant in the site where a tooth has been lost. The implant then serves as a foundation that allows the connection of prosthesis to restore the patient both aesthetically and functionally. The dental literature demonstrates that there are different timelines for rehabilitating an osseointegrated implant, and several factors help determine when an implant should or can be restored. Among these factors are bone quality and quantity, occlusion, and especially implant stability. However, it is very common for doubts or insecurities to arise during the assessment of the stability, which in cases of incorrect load or function may lead to implant failure. Integration Diagnostics is a Swedish company responsible for the Penguin Go, a device that through a technology called RFA is capable of providing clinicians with information on whether or not an implant is ready to safely receive loading. Through a numerical scale ranging from 0 to 99, it is possible to identify over time how implant stability is evolving and consequently how osseointegration process is progressing. The ISQ scale has been widely validated in the scientific literature and provides a direct correlation between osseointegration and the ideal moment to restore an implant, assisting clinicians in decision-making when to initiate the restorative phase. Moreover, it is very common to encounter situations in which more than one professional is responsible for the patient's treatment, one overseeing the surgical phase and another responsible for the restorative phase. In such cases, deciding when to restore the implant can become even more challenging. The Penguin Go is an instrument that can simply and effectively assist in this clinical decision-making progress. The professional only needs to connect a device called a multi-peg to the implant and bring the probe tip of Penguin Go close to the implant to begin validating implant stability according to the ISQ scale. Now you may be wondering about the device called multi-peg and how it adapts to different implant brands, platforms, and models available on the market. There is an online library where you can enter the implant manufacturer and model you wish to evaluate, and it will indicate the correct multi-peg to use. The Penguin Go library currently includes the world's leading implant brands, and it's constantly being updated, ensuring that you will have no difficulty finding the appropriate multi-peg for each case. It is worth noting that the multi-pegs can be sterilized and reused up to 20 times, after which they should be discarded. Whether you're an experienced professional or a young clinician, we know that both strive for clinical excellence for their patients. The need to repeat a surgery, the loss of an implant, or the failure of prosthetic rehabilitation is critical and highly relevant. I invite you then to learn more about the Penguin Go and incorporate this new technology into your daily practice.